published widely in the country, where it estimated around 42 to 54% of South Africans were suffering from hypertension. And at that stage, they suggested, which was 2 years ago, they suggested this figure is expected to increase. And why do you think it's such a challenge for us in South Africa? Because if they're talking 42 to 54%, which is a big number, it's just over 57 million of us. So at least half will have hypertension. I mean, it's a frightfully big number.
It is a huge number. If we look at the data, which was, and the South African hypertensive guidelines, they estimated that about 30% of the adult population is hypertensive, and that's now already several years old. The studies that was based on. We have a population which is increasing in terms of its age, so that's a driving factor for obesity, and hypertension. And then, of course, as I'd mentioned, obesity is also at parallel also on the rise, and particularly obesity in the young, and that leads to metabolic issues, and one of them is early hypertension. So we are faced with a tremendous burden. Recognizing it is quite difficult, because really the only way we have of reliably making the diagnosis of hypertension across the country in our health services is to accurately measure blood pressures. We need to use several readings and then categorize that hypertension, and then realize which ones we need to treat and which patients actually need to be referred on to specialists for further investigations.
It's 25 after 7. You're on Medical Monday. We said it is the silent killer. Are there any alert signs, warning notices that the body puts up where you then say, listen, could be hypertension, let me go to the doctor and check it out?
Unfortunately not in most cases of hypertension, which is usually mild with systolic blood pressures of about 140, even up to the moderate ranges of 160. It is asymptomatic, and hence the term you've used, which is the silent killer. Once we have blood pressures which are 180, 200 and above, that's when we start to see some symptoms: headache, fever, shortness of breath, reduced effort tolerance. That means when you aren't able to walk or work as well as you used to. And then in the cases where we term hypertensive urgencies and emergencies, you will start to see things like change in mental status, and then the absolute emergencies such as heart failure, stroke, and of course kidney disease, which is related to chronic untreated hypertension.
So blood pressure is different for various people, but doctors do say it needs to be at a particular norm. It used to be 120 over 80. Has that changed over the years? Or, are you as a physician, when you look at someone and if they come in with 140 over 85, would you still categorize them as being hypertensive?
Not in one reading, unless the patient has had a prior diagnosis of hypertension, and also in the context of that patient. We mistake blood pressures when the patient has been arrested, they're not smoking or having had anything to eat, any caffeine-containing substances, because once you've made the diagnosis of hypertension, you actually now pronounce this on the patient for the rest of their life. So it's important to make the diagnosis accurately. So random readings, elevated pressures, like we said, can be caused by any argument, whether it be over football or which team you support or anything else, any other grass that you might have. Other conditions such as anemia, thyroid disorders, taking of psychoactive substances, and including nicotine as well, will also elevate your blood pressure, and that is not hypertension. Hypertension is a renovascular and humoral disease. It's not just random blood pressures. Blood pressures are used to help us diagnose it, as well as to decide on how well we have actually achieved blood pressure control when treating hypertension.
So is blood pressure the force that the blood moves in our circulatory system, where it hits the arterial walls? Is that the pressure that's being measured or monitored when you do a blood pressure reading?
Roughly speaking, yes, that it is. Yeah.
And it's got a systolic and
diastolic.
So what's the difference? I mean, obviously there's top number and bottom number, right? Could you just define as to what those numbers mean?
So the systolic reading is the reading that we first hear the sounds of the pulse when we reduce the cuff and the blood pressure, the cuff pressure, and the diastolic is when we hear the full pulse again. So systolic occlusion of the pulse, and diastolic is when you hear it again. So we call those Korotkov sounds, and that is the very classical way of measuring blood pressure. We have other ways of measuring it as well. We use automated machines, we use ambulatory machines, and then of course invasive monitoring in certain instances.